So a very common question nowadays is at what age a woman can undergo screening for heart diseases. So as a female cardiologist, I relate a lot to how much stress a woman undergoes, a housewife or a working woman, married, single. Every woman will have their own story, their own type of stress. So nowadays I feel that heart diseases in women are quite increasing in fact, and their risk factors like diabetes, hypertension, high cholesterol are quite high also when compared to men. So at what age a woman should undergo screening? If you ask me, it is compulsory every year for any woman who has attained menopause. Anybody above 40 plus, it is also compulsory because that is the perimenopausal age group. And less than 40 years, it is always better that you regularly meet your cardiologist or family physician and undergo routine cardiac screening. It is very easy to prevent heart diseases. So many people think that if I go to a doctor, they will misdiagnose me and give me too many medications. That is quite a wrong thought in fact. So it is very easy to prevent heart diseases. That is very important, and unless you meet your family physician or your doctor, you will not realize or recognize the symptoms that you might have missed. So most of my patients say that I have some heartburn, I have some giddiness, I feel very tired. So these can actually be some hidden heart disease complaints. So it is very important that screening for heart disease starts at a very early age. Yeah, so another important message that I would like to convey is that women should not ignore their symptoms. They should also make their health a big priority. They should meet the doctor regularly, and unless you convey properly to the doctor may not be able to understand your symptoms also. So, and a regular master checkup will cover your routine ECG, your echocardiogram, a treadmill test, routine blood test. So these routine blood tests can pick up whether you have diabetes, you have early onset of pre-diabetes, or you have a high cholesterol. It is not uncommon nowadays that women also tend to have early onset of diabetes, hypertension and high cholesterol. And if you are able to control and correct these abnormalities, you can prevent heart diseases in future very easily. Many women tend to ignore their symptoms. They tend to come very late. They don't do their routine master checkups, and finally they end up with major heart attacks or major other heart conditions which could have been easily prevented earlier if we had diagnosed them earlier. And my most important message to all women, irrespective of their age group, is meet your doctor regularly, do your routine cardiac screening and never ignore your symptoms.